Today we're talking about exertional heat illness, specifically how to tell heat exhaustion apart from heat stroke and why getting that distinction right and fast can be the difference between an athlete walking it off and a life-threatening emergency.
Defines each condition. Both conditions are confirmed the same way, a rectal temperature combined with how much the nervous system is affected. Heat exhaustion usually sits at or below 104 degrees Fahrenheit. The athlete can't continue exercising and they might feel dizzy or have a headache, but they're still cognitively themselves. Heat stroke is 105 degrees Fahrenheit and up, plus obvious CNS dysfunction, personality changes, combativeness, real confusion, not just feeling foggy. A lot of the symptoms actually overlap. Dehydration, headache, staggering, syncope show up in both conditions, so you can't diagnose off symptoms alone. What actually separates them is cognitive status and rectal temperature. A lot of people assume that heat stroke means the skin goes dry, but that's not reliable. Patients are almost always still sweating heavily when they collapse. Waiting for skin to dry as your sign will only delay treatment. Treatment usually is based on severity. For heat exhaustion, move them to the shade, rehydrate if they're responsive, remove excess gear, and cool with ice towels. Most recover within a couple minutes to a couple hours. Heat stroke is a different level of urgency. Cold water immersion, usually from 35 to 55 degrees Fahrenheit, is recommended immediately. Get as many hands as you need to get them into the tub. Stir the water continuously and recheck rectal temp and vitals every 5 minutes. That immersion cools about 1 degree every 3 minutes. Nothing else comes close to that. And the rule that matters most, don't stop cooling to rush to the hospital. Cool first, transport second, unless another emergency demands otherwise. So if you're ever unsure which one you're looking at, treat it as heat stroke. Call 911, cool aggressively, and don't wait around to see if it gets worse. A misjudged heat stroke can be fatal within minutes. We've established that foundation. Let's walk through evaluation and treatment in more detail.
And I'm going to be explaining what to do if someone is experiencing exertional heat stroke. So the first thing you want to do when you go up to the patient is to check for circulation and airway breathing, make sure they have a pulse and everything like that. If they do, then the next thing you want to do is take their rectal temperature. So what you're going to do, ideally you would have them lying on their side with their hip and knee flexed, but because of the individual I'm working with, I'm just going to leave them on their stomach for now to make it a little bit easier. So what you do is you pull down their pants, and ideally you would use a towel. If you had extra help, they could help close off from anyone else seeing. You want to take the rectal thermistor and you can wipe it off with an alcohol prep pad. You want to add some lubricant to it to make it a little bit easier to go in, and you're going to stick it in. If you experience any resistance, you can take it out and try again. You want to make sure you get it at least 4 inches past the anal sphincter. Keep going. And then you want to make sure you tape it down, whether that's to like their glutes or their thigh or whatever. You want to pull back up the shorts. And then what you want to immediately do is to put them in a cold water immersion, continuously checking the temperature as well as the vitals. And you don't want to take them out of the cold water immersion until their temperature gets down to 102.